Hello, I'm Dr. Alicia Reisner-Bowman. In this webinar, we're going to be discussing behavior management techniques that can be utilized to make caring for an individual easier, not only in the provider office, but also at home. These are some of my affiliations, and as I mentioned before, I've been treating individuals with special needs for 25 years, and many things I'm going to share with you are tricks of the trade that I have found helpful and that have helped me make caring for individuals easier. And I hope that you will find that they help you make care easier as well. Again, we would like to thank the Dental Trade Alliance Foundation for their generous grant that has made these webinars possible. This is again that standard disclosure saying that I have no financial interest in any of the products that I am going to mention in any of the webinars. Please remember that this webinar is part of a series of modules that are designed for helping care for the individuals with special needs. Please view the introductory webinar before watching this webinar. It will help make this webinar more understandable and more enjoyable to view the introduction first. These are the learning objectives, or as I like to say, the stuff we hope we can learn you over the next 45 minutes or so. Dealing with resistant behaviors is not only a challenge for the caregiver providing care to somebody, it's also a challenge for the individual themselves. They may realize they have a behavior that makes it difficult to take care of them, and as they become more anxious about that fact, it can make it seem as though they're becoming more and more resistant when they're truly more and more afraid that you're not going to be able to overcome the problem, and then they might get hurt. Problems associated can therefore be seen not only for the caregiver, but also for the individual. Caregivers and staff in dental offices also have to keep in mind, you want to be careful that you're not going to cause someone to be injured inadvertently. One of the challenges we often face is that caregivers will stop trying to overcome those obstacles they're facing and simply say, well, they don't want me to do it and they have a right to refuse. Eventually, as we said in the introduction, that right to refuse can turn into supervised neglect. So my job today is to hopefully teach you some methods you can use so that these resistant behaviors will not be as problematic and we can provide the oral care that people need. Now, many caregivers do not understand the importance of oral care and overall health. As providers, our job is to help you to better understand that, hoping that understanding the importance will help you be more motivated to improve that oral care. The individual we're caring for may or may not be able to understand that relationship, but if we can show an improvement in health based on an improvement in oral care, hopefully they'll become more receptive to the oral care that we're trying to provide. Our goals are to identify those limitations and figure out how we can make it so those limitations no longer keep us from being able to provide good oral care. Any care for that matter. Anything that we're trying to accomplish to provide better health for an individual can be made easier with a lot of the techniques I'm going to share with you. So the goals for oral health professionals or for anybody providing care to an individual with a special need is to identify those things that are causing them to be unable to provide good oral care. Identify those challenges and come up with a plan that will help address those challenges. We want to make sure that we are going to be safe. We're going to be able to see what we're doing. We're going to be able to do the job we intend to do. And we also want to make sure that as we develop the plan we're creating can be executed not only in the office, but also at home. So we want to say to ourselves, how do we get out of our box about how we think things need to be done? And how do we get into their box so that we can be able to provide good oral care in a way that can overcome the problems they're facing? Why is the patient or person we're caring for behaving the way that they are? What's influencing this? What can we do to stop it? Are we hurting them? Are they hurting us? Let's take a look at the ways that we can make things easier. First off, let's work on creating an environment that works. Not everyone can stand at the sink and clean their teeth. So when you're providing that care, you want to make sure that you have the person positioned in a way that you can see. Maybe they need to sit down. Maybe have them in a different room where they can lay down. When someone lays back, you can see in their mouth more easily. As caregivers and as oral care professionals, we need to keep in mind when we're working with our patients in the dental chair, we generally sit them back so that we can see what we're doing. Well, caregivers need to think about sitting them back so that they can see what they're doing. We talk about providing care from that, 9 o'clock to 12 o'clock position when we're in the dental office. Talk to your caregivers about getting behind the patient and providing care from that 9 o'clock to 12 o'clock position. Providing care from the front can be helpful when that's the only direction you can come in, but this is really the way that we're used to working. The environment needs to be safe not only for the person we're caring for, but it also needs to remain safe for the person providing the care and the office staff or the staff or the health professionals providing care. If we're aware of something that happens when we're trying to provide oral care, we all need to be sharing that information, because part of developing that oral care plan is going to involve saying, this person does this when they start getting upset. They've been known to punch at people or push them away. You need to be aware of that. And then we also need to say to ourselves, well, if I was the person providing care, how would I try to overcome that? We as oral care professionals need to work with you to come up with ways to keep things safe. And remember, these methods we're talking about are not including drugs or the use of pharmacologic agents, okay? Many people will say, well, just sedate them or knock them out. You can't sedate somebody every single day to brush their teeth and floss their teeth. It's not safe and it's not going to happen. We're focusing more on the things that we can try to do to not only provide care in the home, but a lot of these tips will help you at the dental office if you're willing to take that time and work through those problems. We want to be sure that we can see what we're doing and that we have access to where we're going. You can hurt somebody when you can't see what you're doing. And if you are hurting them, such as hitting their tongue or the roof of the mouth, they're going to become more and more resistant to what it is you're trying to do. So it's important for all of us to work together to make sure that we can position someone or position ourselves to be able to see what we're doing. We need to be able to perhaps hold the mouth open, move the cheeks out of the way, those types of things so that everybody can stay safe. And keep in mind, the individual that you're taking care for, they don't want to hurt you. They want to stay safe too. But if they find that they cannot control keeping their mouth open and it snaps shut, they're going to bite you. They know that might happen, So they may be resistant to having you get in there in the first place because they don't want to hurt you. So remember, it's a two-way street, and you need to try to sort out what's going on. Is it an aggressive behavior? Is it a self-protective behavior? Or is it simply fear? Some of the techniques we're going to discuss are listed here, and we'll go into each of these shortly. Now, the medical immobilization and protective stabilization techniques, those are going to be addressed in a separate module because they are quite a bit more technical, and they involve utilizing methods that aren't quite as simple as those that we're going to be using in this webinar. So please take the time to view that webinar as well. Positioning is very important, not only for the vision and access that we just discussed, but also to support the patient and keep them comfortable. When you have a person that you're caring for in the dental chair, the patient, you need to keep in mind their neck needs to be supported. We have those fully articulating headrests. Use them, move them around, support the person's neck and head appropriately so that when they're sitting back, you're not seeing their head all the way up, pointed up at the sky, their jaws, chins facing the light, and you can't see anything. That's also going to help you to save your back, your neck, and your shoulders. This becomes true for caregivers at home. When you have somebody that you're caring for, if you choose the location to be the bed or the couch, when you lay them back, you want to support their head appropriately, and you want to have them at a level so that you're not stooped over yourself in an awkward, uncomfortable position either. So here are some good ideas. Another is to have the patient or the person you're caring for in a beanbag if necessary. That will provide good support as well as allow you to get to where you need to. Tell, show, do is a technique that we learn early on in life. We tell someone how to do something, we show them how to do it, and then we do it. When you're talking about dental procedures, you have to keep in mind when you're telling them what you're going to do, you don't want to get too technical. Make sure that you're making your explanation meet the learning level of the person that you're talking to. When you're showing some simple tricks that I'll share for our oral health care providers, when you run a slow hand speed backwards, those burrs won't cut. So you can then bounce that on someone's finger so they can get a feel for what that's going to feel like when you're using it in the mouth. Many people have sensory issues, and having that feeling and knowing what that feeling is going to be extremely helpful. In the process of telling what you're going to do, keep it simple. We're going to fix the hole in your tooth. We're going to clean out the sugar bugs. We're going to squish in a silver star. Bada bing, bada boom, you're going to be done. Okay? Showing them what you're going to do. We're going to tap it with our little rotary guy that's going to clean out all the sugar bugs. This is our super special toothbrush. We're going to wash it with our power washer. We're going to suck all those sugar bugs down, Mr. Sucky, or down our little straw. And then we're going to smoosh in a silver star, nice and tight and shiny, and you're going to be all finished. And you can do all of those things on their fingers, on the tray, on a bib, on mom, on dad, anyone else. Make sure that they understand what you're talking about, and then do the procedure. And as you're doing the procedure, continue those explanations using the same words that you used when you were telling and showing. It becomes confusing if you're not using the same language for each step along the way. If you call them sugar bugs, call them sugar bugs, call them sugar bugs. If you call it decay, call it decay, call it decay, right? Positive reinforcement has been shown to be much more successful in controlling behavior than negative reinforcement. Something I always find kind of entertaining is when you have a parent telling a 2-year-old or a 3-year-old that if they don't brush their teeth, they're going to get cavities. Let's think about this. Do you think a 3-year-old has any idea what you're talking about? No. So that type of a reinforcement isn't going to work. You need to think about things that matter to the person that you are talking to. So positive reinforcement, rewarding those behaviors, those things that are leading to the goals you're trying to achieve, have been shown to always be much more successful. If the person opens their mouth when you're asking about taking care of their teeth, hey, thank you for opening your mouth nice and big. Can you show me that big open again? Instead of, oh, stop closing your mouth, okay? Also keep in mind too, what type of reinforcement you're offering. Unfortunately, many of the individuals with special needs are being pop or coffee or candy or something similar when they do something that they're supposed to do. I don't know how many times I've heard a staff person reinforce, okay, now come on, keep being a good helper and we can go get that pop when we're done. If that's their daily reward for accomplishing tasks, that's going to be a big problem when it comes to the oral care, right? So you also want to talk to staff and caregivers about what types of rewards are being used. If you're a parent and you have an individual in a group home setting, ask how that's being handled. And if it's something that you know might be affecting their overall health or their oral health, talk to the healthcare providers about it and say, hey, this is something you need to be aware of. They're giving them soda every time, every day as their reward for having a good day. How should we manage that? It's going to be a big problem for their health or their oral health. This would just my way of saying sometimes offering more time doing a favorite activity, sometimes offering more time with the pets, or being rewarded with, whoever's our biggest helper cleaning up today gets to be the person who takes care of the dog tomorrow. Those types of things can be very helpful, but it's very important that everybody values the reward that's being offered. To tell somebody that, oh, we're going to go and do such and such, and they're like, I don't want to go do that, that isn't going to help you out. Reinforcement involves utilizing the techniques in more than one thing. So when you go to the dentist or your other healthcare providers and they show you a technique that they would like you to use, for example, toothbrushing, using a certain method, when you do that at home as well, every single time you brush the teeth, you're reinforcing the behavior that we want them to use in the office. So it becomes habit. When someone's monkeying around with my mouth, this is what I'm supposed to do. And share that with other caregivers. I very often hear, well, grandma doesn't brush his teeth, or, oh, when he goes to school, nobody takes care of his teeth. Talk to the people that are responsible for the care of the individual and make sure everyone is on the same page. Something that you can always use to entice cooperation is the fact that when someone gets into a routine and has a healthy mouth, they're going to feel better, they're going to behave better, they're going to cooperate better, and maybe you're going to learn a technique that can be used for other things as well, like brushing the hair, clipping the nails, staying in their seat. Those types of things can be very helpful. Direct communication seems simple, but it's very often overlooked. We mentioned in our medical management that we like to discuss things with the individual and then we get our answers from the other person. That's the part of direct communication that is so important. Let me give you an example. I had a patient who came in who had a reputation for being extremely aggressive against staff people, her own parents, other healthcare providers, and every other dentist who had tried to take care of her had said, nope, she's got to go to the OR and we're not going to do anything because she really doesn't have any problems and having her go to the OR is too high of a risk. So basically, everyone had kind of given up on her. I was warned about it. She shows up and she has 2 staff people accompanying her. That means she's known for being a problem. And I thought, everybody came in and everybody who knew her had this aura about them regarding the fact that, oh, she's going to be a problem. Okay? So I'm not going to do that. I spoke directly to her. I said, Joan, how are you today? I'm so glad you were able to come. I need to take a good look at your mouth and make sure everything in there is okay. Would you mind sitting in this chair for me, or maybe this chair, so that I can see better, if that's okay with you? And I was looking her right in the face and talking to her directly. I paid no attention to the surrounding people who were saying, be careful. I said, you know what? Shh, just be quiet. In a nice way, of course. She sat down. I again looked at her. I told her, now I need you to open your mouth for me, but I realize that might be a problem. So how about we open, I take a look, I'll come right back out again, and then we can go from there. Now she's staring at me with that kind of look that you get when someone's really wondering whether or not they should be listening to you or punch you in the nose. You know that look? She opened her mouth. She still had that look, but she was opening her mouth. So talking to her directly was achieving things that other people hadn't been able to do. You need to keep in mind, though, for some people, that direct eye contact is taken as offensive from a cultural standpoint, or they're not going to provide that eye contact and it may seem threatening. And keep in mind, too, that individuals with autism very often has that eye aversion. They will not look at you. But oftentimes, if you say to them, look at me, speak to them, and then they're going to look away again, that you can get that attention when you're trying to talk to them. So it's certainly worth asking or giving it an attempt. Keep your body language in mind. We know open body language means hands apart, not crossed over, not in a fearful position. You want to use a nice, gentle touch. Now, this is where I'd like you all to try something. What I'm doing here is not pulling on his ear, okay? Take your fingers and massage your earlobes. Massaging your earlobes is a very relaxing thing. So while you're talking to the caregiver in the room or before you're getting ready to provide oral care for somebody, if you have them laying back in their earlobes, it's relaxing, it's anxiety releasing, and it helps to just make the whole situation a little more calm before you then take on the task that you need to take on. When communicating, it's very important to remember too, we're going to be asking a lot of questions. Asking those questions, make sure you're asking questions that, one, the person can answer, and make sure you're using a communication level they can understand. But two, don't ask a question that can have an answer that you don't want to hear. If you've ever heard the expression, ask me no questions and I'll tell you no lies. Don't ask me a question you don't want to know the answer to. So if you want the answer to be yes, then don't ask a question that can be answered no. How does that work? Ask the question that's going to achieve the behavior you want, such as, will you sit in the chair facing this way, or is it easier to face that way? Would you like to brush your teeth with the red toothbrush or the blue toothbrush? Things like that. And sometimes you have to educate caregivers. You'll catch them asking a lot of questions that can be negative. Honey, will you please open your mouth for the dentist? No. What are you going to do now? Also, keep in mind that when you have an individual in the chair, and we talked about this we do talk about this in our medical module as well, very often the staff person, the parent, wants to answer questions for you. You're asking the individual, the answers are coming from somewhere else. Sometimes too many people are trying to lead the conversation or trying to run how things are going. That can also cause confusion, and it will be too disruptive to help make it a successful session. So determine ahead of time who's going to lead the discussion, who you prefer to be the person asking the questions, and whether the person can respond or not. Should you ask them and then turn to the care person for the answer? Make it clear to them that that's the way you want things to roll. Decision making, like we said, choices make people not only feel as though they're participating, but it also makes them feel like they have a little bit of control. So use that to your advantage. Only give choices that lead to a positive, but don't give so many choices that they're forever deciding. Shaking by successive approximations. This is different than positive reinforcement alone, because sometimes positive reinforcement is going to be the final thing that's given after a whole set of tasks. Successive approximations is different in the sense that you have to work in baby steps. And for each step that is accomplished, you reward and praise and make sure that you're happy with what's going on. Now, we don't have time to spend, 20 sessions getting it so that we can get a toothbrush in someone's mouth. But you can utilize occupational therapists, you can utilize office auxiliaries. They can take that time to get the goal accomplished, even if it's just a baby step at a time. For example, we had a person hadn't had her teeth brushed ever. She was in her 30s, wouldn't open her mouth. The nursing staff, when we managed to get her mouth open and see what was going on, they came right on board with developing a plan, and they had to start by just brushing her cheek with the toothbrush, getting her used to that feeling. Then rubbing the toothbrush against her lips, getting her used to that feeling. Then kind of smushing that toothbrush between the lips and touching the teeth, getting her used to that feeling. So you can see where I'm going with this. Each of those steps required hours and hours and hours of work. But that's successive approximation. Step 1, step 2, step 3, until you reach your final goal. A good example to use too, and I'm using the example with my light, that could also be a rotary toothbrush. You can start by letting the individual that you're working with, let them hold it by themselves. First goal, okay, they're feeling it, they're getting used to it. Our goal is that they can tolerate it just being around them. Next goal, help them put that in their mouth. Now, hand over hand, as you can see here, my hands are guiding her hand to do what it is her hands need to be doing. Okay? Then the next step, now I'm holding it and I'm doing what I need to do, but very often she's going to also be holding my hand and helping me. So we go from my hand over her hand to her hand over my hand. I'm still doing what I want. I have to kind of fight her a little bit with her holding, but I'm now controlling it, but she's the helper. And then eventually allowing me to work alone, that's the final goal. So you may have to do that with a rotary toothbrush, a manual toothbrush, or something else as well. Distractions are those things that put someone's attention elsewhere. The previous picture you saw the mirror. I don't know why, but many times having an individual hold a mirror and watch what you're doing is extremely helpful. So when you're having challenges with brushing teeth, ask, do you want to watch while I do it? And let them hold the mirror. The other thing that happens when they're holding the mirror, one hand is now occupied and it's not trying to do something negative like push at you or push at the toothbrush, right? Distractions can also be watching television, listening to the radio. One of my favorite things to point out with distractions is the television. Let's say someone can always be cooperative if they get to watch TV. So, when can you brush their teeth? During commercials. Okay? Do you have to get up, go to the bathroom, brush the teeth, and come back every time? They're not going to do that. But what if you brush the teeth at the couch and say, okay, commercial, time for me to brush the bottom teeth, and you spend that commercial break brushing those bottom teeth and letting them spit in a cup. Next commercial break, you're brushing the top teeth, right? Two goals being accomplished at once. Also, the other thing I like to point out is most TVs have a remote control. When they're being helpful, the TV's on, they can watch TV while you're doing what it is you got to do. They're not being cooperative, boop, off goes that distraction. They're being cooperative, boop, distraction can come back on. Blindfolds are useful for people that just do not want to see what's going on, or for that person that's always looking around to see what are you going to do, what are you going to do, if they can tolerate. Another little trick I'll share with my oral health professionals is when you're going to give an injection, shine that light right in their eyes. They're going to have to close their eyes and they're not going to see what's coming. And then if you have good technique, they'll never know. Gagging is something that we deal with constantly, and it very often can cause problems with good oral care at home. Anytime that tongue is stimulated in just the right place, it's going to cause that gag response. So here's some tricks of the trade. You can have somebody suck on a sugar-free lozenge, like a throat lozenge, to help numb their throat before providing oral care. Having somebody gargle with a Listerine or other alcoholic type of mouthwash and spit, if they can tolerate it, can be helpful. In the dental office, we have numbing agents that we sometimes can use to spray to better improve care. But my favorite is this one right here. The acupuncture point for gagging is right here. How do we find that? We have the person, or we bend their arm at the wrist so the palm is coming inward. Then take their two fingers from the opposite hand and measure from the bend 2 fingers width. This here just past is the money spot right there. When pressure is applied there, it helps to stop gagging. So that's what I have patients put their thumb there and squeeze it themselves. Somebody who can't do that, we have used a Velcro strap with a little pillow, and we tighten it so there's enough to feel pressure, but not so much to cut off the circulation, obviously, okay? That works amazingly. I have been in the middle of impressions and someone starts to, impression material. I've reached down, grabbed their arm and squeezed, because I haven't done this measurement yet, but my fingers, 4 length, squeeze their arm and they'll stop right in the middle of the impression. Other things to think about too. Ask the person when they say, oh, I have a terrible gag reflex. I can't do anything without gagging. Ask them if they gag when they eat. Usually the answer is going to be No, I can swallow food without gagging. Well then, when you're doing oral care, start at the front and slowly make your way to the back. Our mouth is used to feeling things go from the front to the back, and it triggers the brain not to gag. This is the way we get nourishment. So if you have to start brushing from the front and then to the back, or doing what you're doing from the front to the back, that will usually be more successful than diving right into the hard spot. Sequential desensitization is different than the other techniques we were talking about in the sense that you're basically going to divide and conquer. This is when someone can only tolerate care for short little spurts, or their attention span is only enough to handle short little spurts. This is also very helpful for individuals that rock. Some individuals with autism, especially my individuals with Rett syndrome, they rock, and they have to rock. They really can't hold themselves back for a very long period of time. So the sequential desensitization is extremely useful, because if you can stop the rock for a few seconds, get in there and do a little bit of what you need to do, and then let them rock again, and make your way a little bit at a time, you're going to find that you can eventually get the whole thing finished. When you're working with sequential desensitization, you also want to make sure that you're keeping track of what you're doing. If it ends up that you're going to try to brush the top teeth in the morning and the bottom teeth at night because you can't seem to manage to do the whole mouth at once, that may be a better way to do it and a better way to get good oral care rather than any kind of care. But keep track. I do the top in the morning, I do the bottom at night, and make sure that you keep track. You can make a little chart to keep track if you have to do just a couple teeth at a time, or if you have to divide the mouth in half. When I talk about quadrants, you can divide the mouth into 4 sections or 6 sections. You can split it in the middle, that's a quadrant, that's a quadrant, and that's a quadrant. Or you can divide it into 6 and you get the back, the front, the back, the back, the front, the back. Any way you need to divide it up that's going to be long enough to do a decent job, but short enough for the patient to tolerate. The sequential desensitization is also when you introduce one item at a time. Be methodical, do it in pieces. Again, this can be used with a speech therapist, an occupational therapist, a nurse, an assistant, a hygienist. All those people can help work on developing that plan and tracking that plan. The determined technique is a different type of sequential tasking, and it kind of puts together several things we talked about. The way this works is kind of like a tell, show, do, but also saying, this is what we're going to do. This is how long we're going to do it. Then you're going to get a break. Many individuals with autism, Rett syndrome, etc., this works great because routine is so important. So we're going to clean 2 teeth, or we're going to clean some teeth, and I'm going to count to 5. When I finish 5, you'll be able to close your mouth and take a little break. Okay, 1, 2, and as I'm counting, or someone else is counting, I'm in there cleaning 1 or 2 teeth, 3 teeth with my little scaler. When that person reaches 5, I'm out. They get to close and take a break. Knowing that that break is coming is what makes this method so successful. When you start getting in there and brushing somebody's teeth and you go for 2 minutes straight and all that toothpaste is building up and you've got this foamy mess in there and they've got spit everywhere and they're trying to, they can't breathe through their mouth, so they're trying to breathe through their, I mean, it really, if you put yourself in their shoes, it's not easy. So saying, okay, we're going to do the lower right, then you're going to get a chance to spit. Lower left, then you're going to get a chance to spit, etc. Dividing things up, counting helps to make it more useful. I have seen this work not only for individuals with autism, individuals with learning impairments, ADHD, attention deficit. We've shown this to people and they've gone from not being able to do anything to being able to brush the teeth, trim the nails, comb the hair. It's amazing the transformation you see in a caregiver when you give them a tool that is so simple. And again, when you introduce this tool, ask them to use it for everything that they can. That way, it becomes such a part of the routine that when they come to your office, you can be using that routine and get things accomplished. Modeling is when you show somebody what it is you want them to do. For example, sit back, open your mouth, wearing the blindfold. Obviously, this is me showing you how that works. Then you can have the patient sit back with the blindfold and open their mouth. Oftentimes, offices will have puppets available to help show you this. This was our Sammy the snake, whose mouth opened really super big, and you could put the toothbrush in his tail. It was just adorable. But oftentimes, modeling on something that the individual finds dear to them, and then having them have the ability to see that what you just didn't hurt that object that they value, also reinforces that, okay, if you could brush, my stuffed dog's teeth, then maybe you can brush my teeth as well. And not only are you showing them that it isn't going to hurt anything, you're showing them what it is they need to do to be successful as well. Perceived control is kind of an interesting thing. One of the things we studied when I was in dental school is that we found that people with a real need for control also had a lot more issues with chronic pain. So when you could address their control problems, you could reduce their pain. There's also studies showing that people have a higher fear when they become more anxious than when they are not anxious. And if that anxiety is being caused by feeling out of control, their anxiety level is going to go sky high. So how can we control their anxiety levels by giving them control back? If they need, you got to give it back. So basically, how do you deal with a control freak? You give them control, but you have to give them control in a way that is going to be positive for you. Let them help. Now, that is what I think makes the mirror successful, because I think, but I can't say for sure, when you're watching in the mirror, you feel as though you're making sure the other person doesn't do something wrong. And you can see if they're about to do something you don't like, and you can say, hey, now, wait a minute, stop. You're not doing that right, okay? The other thing is by giving somebody something as simple as a saliva ejector. Many individuals do not like when they're sitting back and all that water and everything else is building up. So they're constantly taking breaks and coughing and gagging and doing the because there's, something in their mouth, okay? Handing them the saliva ejector and telling them they can hold that right here and move it around here without being in your way eases their mind, because they're now in control of that thing that makes it so hard for them to be there. This is also valuable at home. Give them control of the light, where they sit, etc. When they get to pick which colored toothbrush, they made the decision, not you. I made the choice. When you say, we need to brush your teeth, we're going to brush either after dinner or right before you watch Sesame Street. Which one should we do? After dinner or before Sesame Street? Well, they're making the choice. You've put the situation in their control to a certain extent. We already discussed location, but keep in mind it doesn't have to be in the bathroom at the sink. You can have them in any location that you find useful. I'm often told people enjoy their tubby or their shower. Then take care of their oral care when they're in the tubby or when they're in the shower. Make sure that you can sit them back and support their head if you need to, and do it wherever is the most convenient and comfortable for them. This wonderful gal would only let me take care of her at the office if we were over by the sink. Every time she'd come in and say, I'm not going to sit there. She'd point at the dental chair. And I said, well, will you sit here? Nope, won't sit there. And the staff would say, okay, she's not helping, let's go. And they'd leave. Next time again, I won't sit there. I won't sit there. I said, wait a minute. Where will you go so that I can brush your teeth? Is there any place in this room where I'll be able to brush your teeth? She pointed at the sink in the corner. I said, okay. She walked over to the sink, and I was able to clean her teeth and take a look around. And I said, how come you let me take care of you here, but you won't let me take care of you here? And the answer was, the sink is where we take care of our teeth. We take care of our teeth at the sink. So everything I did, I had to do at the sink. What do you know? Living room, bedroom, sit them back, get them comfortable. If you need to use the television as a distractor, if you need to be able to see in there more easily, if you need to sneak it in when they're in the middle of something else, think of ways that you can do that in a place that's favorable. It doesn't have to be the sink. It doesn't have to be the bathroom. It just has to get done. Resistance that's being caused by frustration. What do we mean by frustration? Every time you try to brush my teeth, you end up whacking my lips or interrupting my playtime or something else, so I'm not going to cooperate. This was a big problem when we had too many toys in the waiting room. So we'd pick them up to bring them back for their visit or their appointment, and they'd start kicking up a fit. And we kept thinking it was because they're coming back and what we're doing. Of course, the parents, oh, the evil dentist is taking them in to do whatever they're going to do. That had nothing to do with us. They were getting upset because we were taking them away from the toys that they were playing with out in the waiting room. If they could have brought the toy in with them and continued to play with it while they were in the chair, they would have been fine. So ask yourself, are they just frustrated because we're trying to do something when they're not prepared to do it? Do we need to try another time? Do we need to try utilizing an occupational or a physical therapist or nurse or somebody to get them involved in some type of sensory stimulation, get them used to what it is we're trying to do before we actually try to do it? Keep in mind, it's not always obvious what's causing the problem. Ask, investigate. Why won't you let me take care of you today? What seems to be the problem? If they're capable of answering, they'll answer. They may just look at you, shake their head, may use a naughty word. You don't know. But if you don't ask, if you don't try to show that you're making a caring effort to improve things, you're not going to be able to succeed and develop a plan that works. Now, when you are utilizing these different techniques, keep a record of the achievements that you get. Each time a little goal is reached, reward it, mark it down, and share it with the caregivers who are helping you divide the plan. You also want to think about whether something worked for a while and then it stopped working. What may have happened to make it stop working? Write those things down as well and report back to the caregivers. By keeping records, keeping track of what's going on, keeping track of, okay, what level of success are they at? So when they come back in to see me, I can stay at that same level if necessary, or maybe we need to, schedule them out a little further, make it clear when they reach this goal, bring them back in, and we'll do what we need to do. Work together, develop a plan, and keep track. So here's a conglomeration of lots of techniques, and you already saw her. So I can only take care of her at the sink. We talked about that. She does not like the sound of anything we use, so I had to run everything ahead of time, bounce the handpiece on her finger, run the Profi Whiz on her finger, take the toothbrush, if it was a rotary toothbrush that made noise, had to get her used to the bzzz noise, and then she was fine. Then after I showed her what I was going to do, we had to use the count and break. So now she's prepared. This is what I'm going to do, and I'm going to count to 5. And after 5, I'm going to give you a little break. In I go, got the Profi Whiz. She's opening, she's cooperating, counting to 5. 1, 2, 3, 4, 5. Okay, she turns, spits in the sink, and then we go back to it again. So we've used a lot of different techniques here in order to accomplish one task, cleaning her teeth. But it's all the different techniques together that made the oral care plan successful. And once you figure out what that is, you need to then share that with the person providing care. Now, unfortunately, that person isn't always the one that's going to be providing the direct care. So if you have to draw pictures or do a video or have the person that provides the direct care come to the oral care visits or the dental visits to see how to do things, then do that. If you have to have that person come in with one of your auxiliary staff or a nurse, and all that happens is showing how to hold the toothbrush, how to get the mouth open, how to manipulate, do the count and break, how to sit them back. If you have to work with a one-on-one, hands-on, hands-off type of situation, plan a separate visit to do that. And there are actually codes now available to help pay for that time that you use developing the plan, doing the behavior modification, doing the oral hygiene instruction. So check out the new CDT codes and take a look at the information for you that lets you know how to pay for those services and make best use of your time as well. So when you're making a plan, remember, it's going to happen at all different levels of care. If you're motivated enough to take care of somebody, they can get motivated enough to help you take care of them. And working together, everybody can create a successful oral care plan. So like I said, think outside of your box and get inside theirs.